When discussing cosmetic surgery, most people seem to think it's only for the women. Well, guess what? This simply isn't true. You blokes make up 10% of all cosmetic procedures here in the United States, and that number is growing. Today we'll follow two men on their journey to get facelifts, right here on The Younger You.
I'm on top of the world, now I'm living, and the good just gets better, keeps on giving. Not even close to the end, it's just beginning. Life is getting lighter while the days are getting brighter, yeah. And it's a good, I won't even worry anymore. Took all my cares, still can kick them all out the door. Go on and try, come and tell me what you're waiting for. Move and keep them going till your life is overflowing, yeah.
Welcome to The Younger You. Today on the show, we're focusing on, well, blokes. Plastic surgery isn't just for women. In fact, just last year, men alone had 1.25 million cosmetic procedures done in the United States. These procedures that we're focusing on today, of course, is called the male facelift. I'll be speaking with Dr. Thompson, who specialises in facial cosmetic surgery, about this procedure. Welcome, Dr. Thompson.
Hi, Troy.
How are you?
Fine.
All right. It's on the blokes today. We've given up on the women.
Right.
Okay, just for today. David and Richard, both having a facelift. We're going to see their procedures a little bit later on in the show.
Yeah.
What is the difference between a male facelift and a female facelift?
Well, the technique of the facelift is very similar, but there are a lot of factors that are different in men and women, as we all realize. And even the surgery itself, men are more likely to have bleeding problems, so we have to be aware of that, and there are just a lot of other things to consider. And, you know, what looks good for a man doesn't necessarily look good for a woman, too.
Well, I said him in the opening of the show, Dr. Thompson, that 1.25 million men alone last year had cosmetic procedures. Do you feel that men are more open to the conversation now than they were, say, 5 years ago? Let's say 5.
I would say yes, but it's still certainly a minority of patients. And a lot of those procedures were simple injectables, Botox fillers, and those make a huge difference for men. And you know, I myself am a squinter, and I love to have Botox right here because it just takes that away.
Oh, I'm converted, you know that. I've been doing it for years. Love the stuff. Do you think it has the same stigma? So the two guys that are having a facelift today, I wonder if people at home will say, oh, they're a bit weak, why do they need to have a facelift? That's for women.
Yeah, I think if you see the patients that we're talking about today and why they had it done, particularly David, who really looked tired and very heavy and you know, was judged immediately on that appearance. I think, you know, we're not trying to make someone look like a Hollywood star. That's not what this is about. It's about trying to make them look like themselves.
Well, I think Richard, who our audience will meet just momentarily, he said his greatest fear in an interview that I did with him, that he didn't want to look like Kenny Rogers and he didn't want to look too done.
Yeah.
Do you think that's the difference between men and women? They want to just look nip.
Well, women don't want to look done either, in general. There are exceptions to that, but in general, everybody wants to look natural. They want to look like themselves. And my goal is to make them look like themselves and get rid of the things that are not making them look like themselves. Because as we age, we actually lose those defining features that give us our identity. And my job is to try and restore that identity.
What do you think cosmetic surgery looks like in the future for men?
That's a very good question, and you know, there are constantly new technologies developing, and everybody wants to have the result with no surgery, and that's what's been going on for decades and decades. But still, when it's all said and done, tried and true is surgery. Now, surgery has advanced leaps and bounds from what it used to be, and that's why patients are starting to look better, they're starting to look more natural, because we've learned so many things about how to do facelift surgery and make it not look like someone had surgery.
Is the downtime different for a man as opposed to a woman?
No, I wouldn't say so. They are really very similar. Everyone's going to bruise, everyone's going to get swollen for a couple of weeks. And,
all right.
But having said that, there are huge differences in individuals from one to the next,
all right.
Men and women.
Now, you said to me when we first brought Richard over for a consultation that you were concerned that he had heavy skin.
Yes.
What does that mean?
Well, the character of the skin varies dramatically from one person to the next, and it varies between men and women. And people with kind of thicker, heavier skin sometimes are more likely to relax and stretch out over time. And so I try to tell everybody that, you know, I show a lot of examples of people that have had surgery, but every person is different, and the way that a person ages after surgery is different. And so there really are, you know, a lot of differences and variations in the way that people respond to the surgery afterward, especially.
Being a younger you is not all about just for you ladies. When we come back, I will continue to chat with Dr. Thompson, and then we'll be meeting our patient, Richard. Well, it's giveaway time here on The Younger You. Enter for your chance to win $1,000 towards liposuction performed by Dr. Benjamin Dunkley. For more information, head over to theyoungeryou.tv/contests to enter. The following footage contains actual surgical procedures. It may be too graphic for some viewers. Let's find out a little bit more from Dr. Thompson about a male facelift procedure, and afterwards we're going to hear from Richard, our patient. Interesting question I want to pose to you. We have a facelift, so we're pulling up the skin.
Right.
Men have facial hair.
Right.
How does it affect that look?
Yeah, that presents a challenge that we don't have with women because...
Well, you don't know what I doll.
The whole idea of a facelift is that we're repositioning the muscle, the deep tissue. We're not just pulling and stretching the skin. Nobody looks good if they're pulled and stretched. But if we reposition the muscle and the soft tissue up and back, that necessitates the hair moving backward as well. And so we'll have a discussion about where exactly are we going to place the incision, because the beard will move a little bit.
Very quickly, do you think you take different consideration where you're going to be putting the stitches on a male as opposed to a female?
Yes, I do, because of that hair issue that we just talked about. For a female, I have a little bit more latitude in what I can do, and for a male, we actually have to have that discussion together and say, all right, these are my challenges with your hair and your beard. Now, what do you think we want to do here? And you know, I can kind of present all the information, and then we can figure out what's best.
Do men scar differently than women when it comes to a facelift? Have you seen a big difference?
No. Typically, if the incision is closed in a very special way, in a meticulous way, the scars should be nearly invisible, whether it's a male or a female.
Okay, probably a really stupid question to ask you. Does a male facelift take longer than a female one?
That's not a stupid question, and it does take longer.
Okay.
And typically...
Really?
Yeah, it does. I always plan on more time for a male facelift because of two things. The bleeding issue that I already talked about. There just tends to be more need for cauterization to prevent bleeding. And men are generally bigger than women, and that translates to the face too. So just because it's bigger, it takes a little bit more time.
What's more complicated, male or female?
I would say they're very similar. It's just a matter of, you know, one takes a little bit more time and has some other considerations. But I really enjoy doing facial restorative surgery on males as well, because it can make a huge difference in what the initial impression is. And we're not necessarily trying for a man to necessarily make them more youthful appearing, but more vigorous and energetic, and instead of looking like they're ready to retire, that they're still ready to work and contribute to society.
Well, we need to head out of the studio and go and watch you in action.
Okay.
I'm Richard. Let's take a look.
Hi, I'm Richard Dutre-Jones. I just turned 61 years old. I have a genetic predisposition to my eyes sagging over my eyes. My mother had to have it done as well, and so I was approved by insurance 10 years ago, but in all honesty, I didn't trust the doctor. And when I was introduced to Dr. Thompson, he made me feel so at ease that I thought, well, maybe I can get up my courage and get my eyes done, because it's starting to happen to me too. And then he talked to me and suggested and asked me about this and said, you know, you've got great skin, but it's really saggy. And I said, well, how would you do that? And he explained how they would do it, and I took up all my courage and took a leap of faith and decided, what the heck, I'll just get it done. Initially, my wife thought this was a great idea, and now she's like, well, wait a minute. Her biggest concern is that I would not look natural. And when I assured her that Dr. Thompson was going to make me look natural, then she told me just a couple nights ago, she was talking to a couple of the kids. We have 4 kids. And she said, you know, Daddy's going to have this done. And I looked at a picture of him from like 15 years ago, and I thought, wow, he looks so darling. And all he's going to do is get his, you know, his little thing in his eyes done, and he'll look just like he did, you know, then. So she's feeling good about it.
So right now we're just working on the upper eyelids and taking some of this excess skin, and that'll give Richard a less heavy look to the eyebrows and the eyelid area. And now we're going to do some work on the lower eyelids, take out some of those fat pockets that are kind of making them look tired underneath. So this is the fat that supports the eyeball, and the membrane that holds it in can become weakened over time, and so I sometimes remove a little bit of that just to get rid of that fullness under the eyes.
Now we've done Richard's eyes, but after the break, we need to go back into the operating room to watch Dr. Thompson perform the rest of Richard's facelift. Like us on Facebook and follow us on Twitter for updates on the show and join the Younger You conversation. Check out the Younger You website to watch full episodes of the show, read about our product of the week, and get useful tips and tricks to help you achieve the Younger You. The following footage contains actual surgical procedures. It may be too graphic for some viewers.
Women, I feel they're more, I don't know, body conscious and more interested in being youthful.
I definitely think women. Well, because we want to look attractive for as long as we can.
I'd say women, but I'm not sure. Like, I don't know.
Honestly, probably women, just because that's how it's always portrayed, you know? It's just like, oh, I got a new facelift, check it out.
Oh, definitely women.
I think men are happier just to look the way they do without trying to enhance things.
I think men are conscious of how they look, but I don't think it comes to the extent of spending that much money on it.
I would if I needed it for some reason, as in repair for my face, but not because of age or anything. Offhand, probably not, but you never know.
I wouldn't.
I'm already scheduled. I've been happy with myself all these years, and now I'm 74, and I feel like this is the very last time that I can make myself look as attractive as I can.
I don't know what a facelift is.
It's a 7-hour operation, right? I almost passed out when he told me that. Really. I mean, I just really panicked. And he had me talk to my cardiologist. My cardiologist said, you're in great shape, there's nothing to worry about. And I just figure I'm in good hands, and I just would rather have him be careful.
So this is an incision that's typical for a male because we don't want to move the sideburn here at all. And so it goes underneath the sideburn, and then the skin will be able to come up without lifting the sideburn at all. And then we go behind this area called the tragus, which will further help to hide the scar when it's all healed up. And then it goes in front of the earlobe, around the corner here. And then we're just going to come behind the earlobe here. And then it's best to make it into the hairline here because it will hide our incision. Sometimes people just do facelifts with a skin flap, and that's not a good idea because it puts a lot of tension on the skin and can give a wide scar and really a short-term result. And you can see even just lifting up this skin how much excess skin he has. I haven't pulled on it at all, but there's just a lot of excess skin that has just developed over the years. So we've got the skin flap raised up widely here, and you can see you can pull on that. But as I said before, if that's all your facelift is based upon, then it's not going to have any longevity. This layer below is the muscle layer, and you can see when we tug on that, we lift up, watch the cheek and the corner of the mouth, they all get lifted upward, and that's really what we're after here.
I feel 30 on the inside. In fact, the truth is I have just as much energy, if not more now, and I'm in better cardiovascular and physical shape, and mentally I know more than I did when I was 30. I'm not saying I need to look 30, but it'd be nice to look a little younger, yeah.
Now we can see this cheek now is resuspended upward, and this fold is a lot shallower here. You can see that this side is up now, and that's without any suturing in the skin. That's just with that deep muscle tissue that's resuspended. So now I'm stitching the muscle together underneath the chin to help give us a cleaner neckline. We're going to put a couple of drains in, and that'll help to catch any extra fluid or bleeding for this first night. And those will come out tomorrow morning. Because this is a big space that has a potential for bleeding, especially in men. Men are a little more likely to bleed. So we definitely want the drain. So right now we're closing the skin up, and we're trying to use natural lines of the face so that the incision won't be as visible, and so that's why I'm going behind this little ear cartilage here, and there's kind of a natural highlight between the ear and the cheek right here that we're sewing up, and then kind of around the edge of the earlobe will help accomplish the same purpose. So we can just see everything's repositioned upward. This fold is not nearly as deep. When I push down on the cheek, it doesn't come down anymore. The jowl doesn't come down, so I think it's going to be a nice change for him.
After the break, we'll be back in the studio to meet another patient, David, and we'll chat with both David and Richard about their final results. Like us on Facebook and follow us on Twitter for updates on the show and join the Younger You conversation. Well, it's giveaway time here on The Younger You. Enter for your chance to win $1,000 towards liposuction performed by Dr. Benjamin Dunkley. For more information, head over to theyoungeryou.tv/contests to enter. Richard and David, welcome to the show.
Thanks for having us.
Okay, now, it's been a bit of a bloke show today. We wanted to show that it wasn't just all about women here on The Younger You, and that men can have facelifts too and also look natural. I want to ask you both, why did you decide to go down this road? You had a similar situation to Richard regarding your eyes.
That's right.
Tell me a little bit about that.
Well, they were drooping quite a bit also. And then I had a case of Bell's palsy back in 1988, which I recovered from, but over the years I think it left the facial nerve kind of damaged, and it allowed the left side of my face to droop more than the right side. So.
That's I didn't know that.
Yeah.
Very interesting. So when you saw Dr. Thompson, did you think to yourself, I don't want to look like, what did you keep saying to me you didn't want to look like, Richard? Kenny Rogers. Did you have a fear of going too far when you were having a facelift?
No, I really didn't. I think that things have progressed quite well in that field to where we don't see much of that anymore.
Do you feel you've been judged as women do when they have a cosmetic procedure?
You know, most people don't even realize that it's been done.
I love that.
So, yeah, same with me.
I was about to say, because Richard, you know, you're out in the public eye all the time.
Right.
Do people, what do they say to you?
They just say I don't look as tired, which is what...
But you tell everyone you're proud of having a facelift.
Yeah, but it's what Scott and I talked about, that I didn't want to look as tired as I did.
Okay, let's bring up Richard's before shot at the age of 61. David, when you see that, do you say to yourself, I can see why he would like to have had that done?
Sure.
Okay.
Having done it myself.
Okay. All right, let's bring up Richard's after shots now. Huge difference, Richard. What do you think when you see that now, 6 months later?
Looks great. Yeah.
Look at the difference.
Yeah.
Huge. Now, we did do a little bit of injections on the top of your forehead. We did a little bit of filler to smooth it out a little bit. You can see, Richard, looking at the before and after shots now, side by side, the neck has completely gone for you.
Yeah, and the eyes are much better now.
Yeah. You know, Dr. Thompson said earlier on about your skin being very dense and very heavy.
He said I had the heaviest skin of anybody he'd ever met, ever. And said that, so it was a big dilemma for him for how much to do, because you know this, but my family's nickname for me was Shar-Pei Dutre, because I looked like my skin was like a Shar-Pei dog, you know, and so anyway.
But that was a concern of his, and you know, you were very concerned about if he took too much out, you would get that result that you didn't want.
It was I think it was very challenging for Dr. Thompson, because he never met anybody. He said I had really good skin, but extremely heavy and very thick.
Okay, so let's bring up your side profile, your before shots, David. Okay, because you also had a little bit of a neck.
Yes.
Okay, and it's interesting that I look at your hairline as well. Okay, this is the before shot, and then when we bring up your after shot, your hairline hasn't moved at all. You know what that means to me? Dr. Thompson is a brilliant surgeon.
Oh, I believe
I
so.
look at that, and I think most men who have had a facelift, their hairline has moved, and it doesn't even look like that. Look at your neck.
Yes.
And I have to be honest, and I'm not just saying this, 10 years off you.
Yeah.
Don't you think, guys?
Yeah.
The eyes are gone. All the jowl around the chin area looks incredible. When you see that, do you think, why didn't I do it 5 years ago?
Well, I had actually looked into it a number of years ago.
Did you?
But because of the time for recovery, being a chiropractor is kind of physical, and so I didn't feel that I really could do it then.
Couple of blokes sitting out there watching you right now, thinking, I'm 60, 65, I want to compete with my colleagues in the business world. You're both businessmen. Do you say to them, this is what you need to do to stay relevant within your business?
Well, I think there's a part of that, but I think it's just up to them, how they want to feel about themselves and who they are. And certainly in today's world, youth is a big factor in business, but I think it depends on the individual.
Well, guys, thank you. I know it was a little bit tough to be asked to watch you go under the knife, but we appreciate it. And thanks for being the guys that wanted to do this as well. I think it's been great.
Well, thank you.
Thank you.
And thanks to Dr. Thompson.
Isn't he amazing?
Honestly, he's amazing. He really is.
I think so. I'm thinking a hair transplant, I need a facelift, I need it all. We are seeing more and more men getting cosmetic surgery, and I do believe it is a growing industry within this category. This just goes to show that anyone and everyone wants to look good and feel great. Having cosmetic surgery, no matter how drastic, can boost a person's confidence and help make them feel great both inside and out. For more information about Dr. Thompson and The Younger You, head over to theyongeryou.tv, and I'll see you next week. Coming up next week, we'll be learning all about Hashimoto's and low thyroid, what you can do to get back to feeling terrific. The Younger You set provided by Madison McCord Interiors.